classmates and Brandy. I'm doing this video to teach you guys all about quad cough. I wanted to do this because in my own clinical experience, I've definitely seen a patient who needed a quad cough and the RT or the caregiver, they didn't have the right technique. So it was very frustrating for the patient, it was frustrating for the RT, and it's something that we don't do a lot in the inpatient setting, but when it is needed, it's important to know how exactly to do it and to be confident in your skills, because typically it's going to be a spinal cord injury patient who knows what they want, knows what they're doing, and you don't want to feel like you don't know what you're doing in front of them. So who gets a quad cough? Our patient Kimberly is going to get it. But any patient who has a spinal cord injury, typically ASIA A, ASIA B, or just anybody who can't generate a strong and productive cough, and who has a lot of secretions that need to be cleared, because we want to clear the secretions. Secretions staying inside the lungs is a very bad deal. We all know this. So we're going to help them out here with this move. And the move is a very simple up and into the diaphragm. You can do a couple different hand variations. You could do the hand over the hand, kind of like a CPR, pushing up and in. Or you could do the two hands in the shape of a W under the ribs to push up the diaphragm. And on Kimberly, it's going to feel different because she has abdomen muscles that are engaging when I push into her. On a true quad patient, your hands are just going to sink in because they're not going to have those muscles engaging. So you do want to be forceful about it. You don't want to be so forceful that you break ribs or cause any damage. And that is something that could potentially make a spinal cord injury patient not like this maneuver, because it may be painful for them. Worst case scenario, they break ribs, they get a flail chest. Don't want that, but you do want to provide enough force to really get that stuff out of there. So starting out, I mean, whether you're in a inpatient setting or a home care setting, you want to protect yourself. There is a potential risk for you to be flying all over the place, so you want mask and personal protective equipment as best as you can. So I'm going to show you two ways how to do this. One laying on the bed, and then one with the patient sitting in a wheelchair. So, hi Kimberly.
Hi.
I'm Rachel, your RT.
Hi, I love you.
I love you. So for a short person like me, it'll be most comfortable for my knee to be below the patient's hip and one foot firmly planted on the ground. You want to always keep in mind good body mechanics, straight back, no hunching over. You want to use your upper body as momentum to push into the diaphragm. If you're comfortable with a patient, you could straddle them. That's another popular way to do it. So I'm going to be using the two-hand technique, and I'm going to locate the xiphoid process and just go under the ribs. And I'm going to, before we do this, we want to really communicate with the patient. Have an open line of communication with the patient. Tell them what you're doing, when you're doing it, how you're doing it. So for this procedure, or this maneuver, we're going to do 3 breaths, in, out, and on the third breath, in, and then I'm going to push and you're going to cough.
Okay.
And just have the patient kind of participate as much as they're able to, depending on their muscle strength. Okay, so I got the two-hand technique, and under the ribs. All right, we're going to go in, out, next one, cough, in, cough. Okay. So that was obviously very successful and productive. Did you feel like you got some?
I definitely got some
stuff
seepage out.
Okay, some secretions.
Yes, that.
So just do that as many times as necessary. The patient will most likely tell you, yes, that worked, or no, that I didn't get anything out, you got to do it again. So listen to your patient, let them know, or they'll let you know what they need. Okay, so we got this laying down part down, right? So we're gonna head up onto the wheelchair. So just some safety issues. Make sure the wheelchair is locked. It's not gonna budge. You're gonna be pushing this patient, so you don't wanna wheel them across the hall. And good body mechanics for this is gonna be a little bit different. You want the feet about shoulder length apart, back straight, and get a little bend in your knee, kind of like a squat. And we're gonna do the same thing with the two hands. We're gonna put them under the ribs, and we're gonna go in, out, in, out. Next one, cough, in, out. Ooh, I heard that. That was productive. We like that. Yay.
Yay! 6-7 minutes. I need it again.